The impact of violence and the road traffic crashes on the society in Jamaica has been very significant. Violence is now known since the 1990s as a public health phenomenon. It should be taken with serious consideration as to how it impacts our society. What we find is that a number of the persons who have suffered from violence or violent behaviors have fallen within the productive lifespan. And if our productive persons are paralyzed or damaged, then our economy will be, in terms of growth and sustainability, will of course be impacted. So it is important in the way forward to ensure that our society remains viable, remains sustainable, that our people understand the impact that these issues have on our society and move forward. One of the areas in which to prevent violent-related illnesses or injuries or even motor vehicle accidents is that there must be a cooperation between and integration actually across the public health, across the health sector, the health care, mental health, even the criminal justice must collaborate.
The project I'm working on as part of the team is looking at the cost of care and data mapping associated with violence-related injuries and road traffic crashes. The project attempts an initial part to look at the cost of a number of these people that present to hospitals for treatment and management of their injuries. Working in the intensive care and in the operating theatre, I've come across a number of these patients. A couple of case studies we've done. One, a small boy, for example, that had suffered from gunshot wounds and spent several weeks in the intensive care unit. And we did a conservative estimate of what we spent taking care of him, and it's about $4 million just during his hospital stay. So the study's purpose is to get an idea of how much we spend taking care of these patients. Where do these injuries occur? Who are the people most likely to be involved? What time of day do they occur? And once we have a profile of the persons who are likely to be involved and where these things occur, we can create effective intervention strategies. I think a lot of in the media, a lot of the focus is on the importance, for example, of the police being involved in solutions. But perhaps we need to be a bit more involved before this whole process. And there's a growing push to look at this as a public health problem, which it really is, considering the effect that we spend and its effect on the public health system as a whole. For example, developing strategies specific, if we can identify specific roads or roadways that are issues, putting in interventions, police lights, crosswalks to try and stop these accidents happening in the first place. Similarly, if we can identify hotspots where violence is occurring through community-based interventions, some involving the police, some not, we can hope to decrease these injuries or decrease the rate at which these injuries occur in the first place.
For many years, there was the perception that injuries played a major role on the effect for patients seeking care at the government hospitals island-wide. These injuries had a negative impact on the services that would be required for patients seeking elective surgery, and also had a much higher cost because of the multiple organs that were damaged, and therefore had a negative impact on the hospital's budget. In 2009, the Jamaica Injury Surveillance System, which included Dr. Ward and myself, did a 5-year retrospective study on the patients presenting to the Kingston Public Hospital who had suffered injuries of various types. This study revealed what the perception suggested, and that was that elective surgeries were postponed for up to 60% of patients, with 1/3 of the patients seeking elective surgery either having the surgery delayed or postponed as a result of the treatment of patients with these injuries. We decided, therefore, that we need to see if this impact was the same across the island. And therefore, in the year 2014, from January to December, we selected 7 hospitals looking at the types of injuries sustained, including road traffic crashes and injuries intentionally given. We selected 7 hospitals. The results of this study will identify not only hotspots of injuries, but hotspots of road traffic crashes, where we may be able to introduce measures such as speed limits, speed traps, pedestrian crossings, and breaches of the Road Traffic Act in an effort to reduce the number of road traffic crashes. We would also be able to put preventive measures in communities where violent crime obtained. In this way, we'll be able to improve the life and livelihood of persons in these communities across the length and breadth of Jamaica. Thank you.
We were happy for the opportunity to be involved in this study, because over the years we have never really taken the time out to see how much it costs us to care for our patients who are involved in crashes and violence. However, throughout this study we recognize that a number of our patients who come into us who requires most of our healthcare services are those who are involved in violent injuries. What we recognize is that those who are in motor vehicle accident, and looking at one case in particular, we recognize that caring for this individual who had to go to the operating theater for more than one occasion, that this person cost us over $700,000 just to ensure that this person remained alive. The sad part of it is that he was unable to walk out as he used to be, and so the burden now impacts his family, where he's the breadwinner and now somebody else will have to take up that responsibility. And what we want to encourage our communities to do is to see how we can now be supportive of each other, be a friend to each person, and learn to forgive. What we would really like to see is how we from health can use this information to collaborate with other facilities and other programs within the parish to see how we mitigate these factors and to help to teach persons coping skills so that they can learn how to walk away from trouble, how they can determine how best we manage our conflict, and so to prevent the maiming of our individuals that comes to us. We want to be conscious road users, because we not only have patients who came in alive and leave alive, but persons who are also dead. And one death is just too many, because it impacts the whole individual and the country at large. And so we're hoping that we can use the result of this study to improve our road skills so that we can be more productive in our country and that we can offer more to the citizens whom we serve, who really needs to be cared for rather than those who come in where we could have prevented.
The importance of this study is that for years we've been trying to determine how much of an impact road traffic crashes and violent injuries have had on the health sector. This is very important for us to determine what percentage of our health budget is actually utilized for managing these preventable conditions. The new way of thinking internationally is about a healthy public policy as opposed to a public health policy. And what a healthy public policy dictates is that each government ministry governs their own ministry, taking the health care of the population into consideration. And therefore, in so doing, we'll be able to build our society in a very systematic and sustained way, because it is the healthy population that is going to drive the society in a way. So doing this cost of care study will help us to transcend the ministries in a sense. So we'll be able to now appeal to other ministries to put the different things in place to reduce the incidences of morbidity and mortality to our population. Now, I want to look at other interventions like prevention in the different communities. So what our database will pick up to a certain extent is from which communities are these violent injuries coming from. Now, it behoves us, since most of the injuries come to secondary care, for us to actually go into the communities where we see most of the violence coming from and try and mitigate against these violent acts occurring. A case in point is the collaboration between the police, the Crime Prevention Committee and the May Pen Hospital, being a part of the Crime Prevention Committee, in going into one of our communities in the May Pen area. We went in as a team, and the violence statistics had gone down significantly since the intervention. And this kind of collaboration between the data received in health, data received by the police, and collaborating as a team, I think we can actually have a big impact on reducing violent injuries which come to the institution using a public health approach. Instead of waiting on the things to come to us, we go to the source and try and have an intervention in those areas, and in the long run having a bigger impact on the outcomes.
What we need to do is education campaign. If those persons are going to carry those injured persons, imagine a person on a motorbike, you know, go up in the air, fell on the neck, and then they are just picked up. If it is near to a hospital like KPH, one person just hold the two hands, hold the feet, and they just run. And they think that is the speed at which you get to the hospital. You don't need that, because they might reach and they end up die or end up being a vegetable. I can tell you we can do it, you know, because in the field, in the hills of St. Andrew, I've seen where farmer been there out there, and what you realize that somebody fell from a tree and they find a piece of board, and they find 2 sandbags and they put it at the neck to secure the spine, and then they strap them with rope and transport them neatly to the hospital, and they save their life and they prevent spinal cord injury. So we need to find a way and let them know it's not the speed of which you reach hospital, but how can you reach there safely. So we need to carry out our education campaign for the many violence-related injury. We need to say it to our young people. We need to find a way to talk about things. Instead of just fighting it out, you argue, you just talk it out. Because in my study, I can remember collecting the data, I could not understand. I came across a file for one patient. When I looked, the person got stabbed 2 weeks, and then I saw next one for the same person who got gunshot wound. Can you imagine that? One person in less than 2 weeks, 2 trauma. So when I look, I said, no, when I check it, it was right. So we realized that we can't continue that way, because this will cause a burden on society and on our family and at the nation at large. Thank you.